à l'évaluation et au processus qui vont s'assurer de la sécurité des Canadiens. On regarde aussi par rapport aux origines des vols et aux déplacements pour voir s'il y a d'autres étapes à prendre. Et on va continuer de travailler à tous les jours pour s'assurer que les Canadiens soient en sécurité. We are looking to reduce the number of airports that will accept travelers from overseas in order to be able to give the proper resources on all arrivals to ensure that we're doing everything we can to keep Canadians and Canada safe. We're also obviously looking at countries of origin and further measures that we can take. We will make those decisions based on the best science, the best recommendations of our health officials.
Est-ce que ça fait partie de vos options de fermer complètement les frontières à certains pays? Et si oui, quels sont vos critères pour en arriver là? Et là aussi, je vous demanderai d'être précis. Est-ce que c'est un nombre de cas au Canada, un niveau de contamination communautaire, etc.?
Nos critères d'évaluation pour les prochaines décisions sont entièrement basés sur les recommandations des experts et les autorités en santé publique. Nous faisons confiance aux experts ici au Canada et à travers le monde et nous allons suivre leurs recommandations. Nous ne fermons pas la porte à toute prochaine étape. Nous regardons qu'est-ce qu'on peut faire pour continuer à faire le travail que nous faisons depuis des semaines pour garder les Canadiens en sécurité et ça va continuer. We will continue to make decisions based on recommendations of medical experts, public health authorities, and top scientists. We understand that we have taken significant measures over the past weeks and month to ensure that Canadians are kept safe and to slow the spread of the virus. We will continue to make determinations about how best to do that based on recommendations of experts. We're not closing the door to any further steps, but we will make those decisions based on what science tells us.
Ryan Tumulty, National Post, sir. The financial markets have had two of their worst days on record this week. I'm just wondering, you talk about the government's fiscal power. Why haven't we used it yet, and what are you planning to do?
2 days ago, we announced a $1 billion plan to help invest in health and support Canadians across the country. We've also put forward measures that will strengthen EI and help Canadians. We recognize there is much more to do. We do not want any Canadian to have to worry about whether or not they're going to be able to pay their rent, whether or not they're going to be able to buy groceries or care for their kids, or elderly family members. We need to make sure that Canadians have the options and the ability to follow the best public health advice and keep themselves safe. That is what we are focused on, and we will be rolling out those measures in the coming days. The Finance Minister will make further announcements later today on concrete measures to support our economy. But further to that, in my conversations with my fellow G7 leaders, we have agreed that it will be important for us to coordinate at a G7 level to impact the global economy. And we will be continuing to follow up on those conversations in the coming days as well.
Direct financial payments to Canadians or to affected industries?
We are looking at ways to help Canadians directly, yes. Particularly vulnerable Canadians who are going to be particularly squeezed if they aren't able to go to work. These are the kinds of things we're focused on. We also know that small businesses may struggle through or will struggle through this period of economic slowdown, of people choosing to stay at home and protect their families. We will look at how to support them so that once we get through this difficult time, our economy and Canadians will continue to prosper. Nous regardons comment on va aider directement les Canadiens qui seraient dans des situations plus difficiles où l'absence d'un chèque de paye pourrait avoir des conséquences extrêmes sur leur capacité de payer leur loyer, de s'occuper de leurs enfants ou des aînés ou de mettre de la nourriture sur la table. Donc, nous allons prendre des mesures directes pour appuyer les Canadiens qui font face à des difficultés à ce point-là. Nous allons aussi chercher à aider nos petites et moyennes entreprises qui vont faire face à des semaines difficiles pendant qu'on répond à cette menace à la santé publique. Nous allons annoncer des mesures cet après-midi par le ministre des Finances, mais aussi en début de semaine prochaine avec d'autres mesures pour directement aider les Canadiens.
Hello, Prime Minister. Catherine Cullen, CBC News. Obviously, we wish good health to all Canadians, but if you are to fall ill, members of your cabinet, for instance, what is the plan for governing?
We have continued to engage. I've been very busy both yesterday and today. We'll continue to work from home remotely to do the important things that need to be done to keep Canadians safe. We have an exceptional cabinet that is working hard on all these issues as well. We have extraordinary public servants who are working as well. We will continue to do the work that needs to be done to keep Canadians safe while following all directions by our public health officials.
I don't think that indicates whether there's a contingency plan in place if you were to fall sick. I'm also curious why public health officials have told you you don't need to be tested.
First of all, there have always been contingency plans for ministers who are sick or have, or even a prime minister who is fallen ill. We will continue to follow all those correct contingency plans. But as I said, for now, I am continuing to work extremely hard from home. In terms of advice I've gotten from medical professionals, it was explained to me that as long as I do not show any symptoms at all, there is no value in having me tested. Je suis les indications des experts en santé publique qui expliquent que tant et aussi longtemps que je n'aurai pas du tout de symptômes du coronavirus, ça ne sert à rien de me tester pour le coronavirus.
Mais justement, là-dessus, il y a des Canadiens qui se posent peut-être la question. Vous êtes un homme en forme, on le sait, vous pourriez avoir la COVID-19, mais pas avoir de symptômes du tout. Vous êtes le premier ministre, vous partagez toujours la même maison que Mme Grégoire Trudeau. Pourquoi ne vous faites pas tester systématiquement à tous les jours en tant que premier ministre?
Les conseils des experts et des médecins, c'est que si je ne démontre pas ou je ne ressens aucun symptôme, ça ne sert à rien de me tester.
Mme Grégoire Trudeau, de ce qu'on a compris, est revenue de Londres samedi dernier ou le week-end dernier. Vous avez rencontré plein de gens au cours de la semaine, notamment à Toronto lundi, également à Ottawa toute la semaine. Vous ne craignez pas avoir été un vecteur de transmission cette semaine?
On a parlé de ça justement avec les experts en santé publique et le fait que je n'ai pas de symptômes, je ne démontre aucun symptôme de la COVID, veut dire que selon eux et selon ce qu'on comprend, il n'y a pas de risque pour les gens avec qui j'aurais travaillé pendant cette semaine.
In English, please.
Okay. According to health officials, the fact that I have expressed absolutely no symptoms means that anyone I engaged with throughout this week has not been put at risk.
Marika Walsh with the Globe and Mail. I'm wondering, given the warnings that Canada is now giving about traveling abroad, should Canadians still be traveling between provinces, between cities, given how different the virus is spreading within Canada?
I think people need to make responsible decisions and check with their medical professionals and check their own travel plans in terms of what makes sense for them. I know that Canadians will listen to the advice of experts and make decisions that are appropriate for them and for their family.
And can you describe specifically what your self-isolation means, both for you and your family and your wife? You're outside right now. Is your wife still going outside? Is your family still going outside? What does self-isolation actually mean for your family?
We, as are many Canadians right now, following very carefully the advice that public health professionals are telling us in terms of what we can do and what we shouldn't do.
So what does that mean?
That means I am in isolation, as are my children, and my wife is in quarantine.
Glenn McGregor, CTV News. Prime Minister, in your conversation with President Trump yesterday, was there any discussion about future access of Canadians to cross the U.S. border and should the situation worsen? And also, do you have any concerns, given the U.S. slow response to this, about Americans coming here?
We have been working very closely with our counterparts in the United States to coordinate our efforts at the border and to align our efforts. There is certainly ongoing conversations that will continue to be had as the situation evolves, but I am confident we will continue to be able to work very closely with the Americans to keep people in North America safe, particularly to keep Canadians safe. On that, it is worth noting that it was one piece of good news that comes out of this situation is that the new NAFTA has now been fully passed and ratified and is now awaiting royal assent, which should happen very quickly.
Just following on my colleague's question, could you describe your situation domestically here in a little more detail? Is your wife here in this house? Are all 3 kids here? And if so, question a lot of Canadians are dealing with is how are you going to keep them occupied for the next 2 weeks?
Most of the morning, the kids have been doing Lego, and my wife has been on the phone to friends and family. I have been on the phone with President Macron, with cabinet, with officials and members of my team as we work to keep Canadians safe.
Good afternoon, Prime Minister. Teresa Wright from the Canadian Press. What is your single biggest concern about Canada's preparedness at this point?
My concern is that Canadians continue to follow the directions of public health authorities. We have to be alert and responsible. We don't want to panic, but we don't want to take this too lightly either. Finding that middle ground is always going to be challenging, but I have tremendous confidence that Canadians are going to be able to.
And what are you telling your children about the heightened sense of concern in the country, and also how are you explaining some of the political decisions that you're making?
We're obviously having some very good conversations with our kids about what's going on, about how not to be overly concerned, but to be a little bit concerned, which is obviously why they are home today with us. We're going to continue to have thoughtful conversations as parents across the country will be having with their kids.
Prime Minister, good afternoon. Bruce Campion-Smith, The Star. Just wondering if you'd walk us through the logic that Canada has not taken the step of restricting international travels. Is that we don't agree with perhaps the science in those countries or the experts in those countries that advocate for such a move?
Different countries will have experts that give them advice that is suitable for their own situation. We have followed the instructions and the advice and the recommendations of our top public health officials. We will recall that in the a number of weeks ago, in the beginnings, there was discussion of whether or not we should entirely close our borders to China the way the United States did. We did not, and we were able to manage it in a way that allowed for control and a non-spread of the virus that gives us confidence that our public health officials are giving us the right recommendations for Canada.
And on the fiscal stimulus package that's coming out, can you just describe to how will that, is that in place of the budget? Is this kind of a series what we could expect now through the end of this crisis?
We are obviously focused primarily on how we are going to get money into the pockets of Canadians who will need it because of this situation. We've had many discussions over the past months about the budget. That work will continue, but our focus right now is on ensuring that Canadians have the resources and the money to not have to stress about rent and about groceries and about childcare and elder care at a time where they're also very worried about their health and their family's health. We will be supporting the economy and Canadians through this time. Notre priorité maintenant demeure la santé et le bien-être des Canadiens. Nous voulons qu'aucun Canadien ne soit préoccupé par la capacité de payer le loyer ou de pouvoir nourrir leurs enfants ou s'occuper des aînés. Nous allons faire tout ce qui est nécessaire pour les aider pendant ces moments difficiles. Évidemment, les réflexions qu'on a depuis des semaines et des mois sur le budget continuent, mais notre emphase va être sur comment aider les Canadiens dans ce moment difficile. Merci tout le monde.
Merci
tout le monde.
Canada.